Hello, good afternoon, and welcome to Lively Conversations. I'm Heather Jones. I am a regional sales director here with Lively. I handle the region with Texas, Oklahoma, Louisiana, and Arkansas. And I am here today with Jordan Mazer, who is our Lively General Counsel. So, goodness, we want to dive into the BBB. Do we all know what that means? The big, beautiful bill, right? We want to jump into that, see what's going on, how that's affecting us in this employee benefits space, and where we're going to move forward and how it's going to affect those HR teams and what you need to know to stay ahead of the game. So I think I'm going to ask Jordan a couple of questions. Jordan, are you down?
That sounds great. It is the one big, beautiful bill, and hopefully someday we'll get a second big, beautiful bill. But for now, let's dive into this one.
I love it. And I like that we coordinated. I know it wasn't planned, but I'm really I'm jiving.
I have to say, you look great.
Thank you. And I love the tie. It's perfect. All right. So Jordan, before we dive into all the details, can you give us like a quick summary of the key changes to employee benefits that are included in this one big, beautiful bill?
Yeah, definitely. So three big takeaways that you need to know about with respect to employee benefits and specifically with the flexibility of the health savings account. Here at Lively, we love the health savings account. The HSA is one of our core offerings, and this bill represents, for the first time, really meaningful change. So three things. The first is the telehealth flexibility. Back when the pandemic first began affecting us, believe it or not, there was not the flexibility to cover telehealth visits without disqualifying your plans from HSA contribution eligibility.
Wow.
So at the time, this was handled with executive orders and short-term fixes. And for the last 4 years, I think any right-thinking individual has been saying, "Come on, this is a no-brainer in the world we live in today." You and I being in different cities right now and having this conversation, pretty good example. So telehealth flexibility is now permanent. So plans can cover virtual care before the deductible without violating that prohibition against first dollar coverage that would get you into trouble with contributing an HSA. That's number one. Second one is direct primary care. And this is a new thing. The direct primary care arrangements are where you negotiate a flat fee on a monthly basis with a physician. Believe it or not, I saw a statistic recently, 5% of American physicians are now going the DPC route. That's what they call it. Direct primary care, again, the question that arises is, does this disqualify me from being able to contribute to an HSA? And then also, can I pay for it with an HSA? What the one big beautiful bill did is say up to a certain limit, and it's different for individuals versus for families, that that kind of an arrangement does not disqualify you from being HSA eligible, contributing to an HSA. And similarly, with those same limits, you can actually pay that monthly fee with your HSA. And for that one, it takes effect on January 1st. The last one, I think it's the most important one. We heard a lot about what the bill was doing in terms of folks maybe losing coverage. I'm not going to weigh in on that. But what I am going to say is the bill did one terrific thing for expanding options for people. And that is in the ACA bronze and catastrophic plans. Bronze, I don't know if you guys remember the ACA, the metal tiers of plans. The ACA bronze and catastrophic plan tier covers 7+ million Americans.
Wow.
And at the time before the bill was signed, 2% of those plans allowed you to contribute to an HSA. The bill now says 100% of those plans. So 7 million people approximately just became eligible to contribute to an HSA. These changes give account holders and employers a lot more room to be creative with benefit design, which I know is right up your alley, Heather. So perhaps we want to get into that. But really, truly, HSAs are 21 years old, and this is the first meaningful expansion that we've had. Arguably, 2006, we had a little bit, but really in the last 2 decades, this is it. So it's a big moment, and people need to know they just got a lot more flexibility.
Right. And I love that, Jordan. Thank you for sharing that. And I just want to kind of tag on to what you said about direct primary care. I am a huge proponent of direct primary care. I've had a direct primary care doctor for 12 years. And I'll share a little something personal real quick. My husband unfortunately passed away from Lou Gehrig's disease, and he went undiagnosed for 5 years, with the system. And then the direct primary care doctor that we worked with, she diagnosed him within 5 minutes and got us going into the right doctors who we need to see, the neurologist and everything. And, unfortunately he's passed away, but we were able to get the care that he needed through that direct primary care. And at the time I was paying for that out of my pocket. So it's so nice to see that it is covered, because again, with insurance and how this works, like, you need to be in the system for certain things, but it's nice to be able to have that option to be able to pay that with our HSA, right? So it gives us more flexibility and options to do some different things. Okay, so a couple more questions for you. Okay, so Jordan, the OBB originally included a huge expansion for the HSAs when it passed the House. But those provisions were stripped, right, from the Senate, the version. Can you walk us through how, you and, we us as RSDs and with Lively, we contributed to this. It was like, how did we, go to the HSA Council and went to, the DC and lobby to the Senate staff and impact those conversations on the final legislation? Like, what did that look like from your standpoint?
Yeah, and this is an important point because as much as I love AI, if you go and ask these AI tools, they might tell you that there are a lot of other things in that bill, and that's because for a while there were. And the version that you may remember, the version passed the House right around Memorial Day, and then the Senate, there was this long process, and the Senate passed a bill, and it had to go back to the House. And the reason for that is the Senate passed a different bill than the House bill. When the committee in Senate that was drafting the bill was the Senate Finance Committee, and when the Senate Finance Committee released their draft of what they were planning to put in their bill, I'm not going to say panic, but my stomach sank because there were 10 provisions in the original House version about HSA expansion, flexibility, and things like that. And the Senate notes the draft, the unofficial version, had zero.
Oh,
And happened to actually be on a plane to Washington, D.C. for our regular meetings of the HSA Council at the time. The HSA Council is a group of folks in the industry that get together, talk about these things, try to get on the same page, believe it or not, with our competitors about these things, and lend the industry viewpoint to government, to our legislators. And often these meetings take the form of like, what are you hearing? What are you hearing? But this time it was something different, right? This time it was, there's real stakes. There are things on the table here. And it was like I said, a stomach dropping moment, but also a moment for action. And so we, along with other members of the HC Council, presented ourselves dutifully the next morning at a number of Senate staff offices and spoke with anyone that was willing to listen to us and emphasized the real world impact of these reforms and emphasized that we are talking about, for instance, in that ACA bronze one, we're talking about 7 million people. And emphasized that we have not had meaningful expansion. We have not kept up with the times. If you think about the way that healthcare has changed in the last 21 years in this country, and specifically around cost, and specifically around giving individuals the opportunity to mitigate the effects of that, giving them the opportunity to make a choice. I think we had some pretty powerful arguments to make, and we did our best to make them. And everything going back in would have been a great win. That's not what happened. But these three provisions that I talked about a few minutes ago, that's what did come into effect. And
sorry.
yeah,
Apologies. She likes HSAs too.
There's they talk about curiosity of cats. We can know for sure these cats are like, wait a minute, you mean what I read on ChatGPT about the HSA expansion wasn't right? So here we are.
Right? It was perfect timing, perfect segue.
Absolutely perfect.
Hi, Spooky.
We got those three provisions back in. I'm not satisfied with that. I don't think Heather's satisfied with that.
Mhm.
And she mentioned that it wasn't just me, and it absolutely was not just me. I played a small part, but we actually spun up an email campaign here at Lively. And so I emailed Heather and said, "Hey, given where you are, here are your elected officials that you could reach out to." And we had folks making phone calls. We had folks sending physical letters, which is a thing you can still do. And we also had folks sending emails and
Can
just
you make them
emphasize,
right? We can do that.
yeah, yeah, right. And just emphasizing that, yeah, obviously we work at a company that's gonna look to capitalize on the expansion. But more importantly, those personal stories like the one that you related, and so many more that you hear when you are working with brokers to design the best possible outcomes for the customers. So by no means are we done. And I think there are specific ones that I could tell you, I really would like to see us take a look at as this legislative session unfolds. But it is a huge step in the right direction.
Oh, I agree. And, Jordan, thank you so much for explaining it because it can be very confusing, right? When it comes to all this legislation, there's so much going on and, so much happening in the government. And like, I'm proud of the company that we work for and that we're at the top of that and we're leading the way. And we're definitely making some differences in where we're going with this legislation and what's happening with HSAs. And so I know we're kind of limited on time, but I did have a couple more questions. I know we're having such a good conversation. Jordan, I feel like I talked to you forever. Like, this is awesome. I love it. Okay, so question for you. This could be a little tricky. So why do you think HSAs continue to receive bipartisan support? So especially at a time when healthcare is such a politically decisive issue, which we just talked about. What is it about HSAs that resonates across party lines? Like, what is your thought there? Like,
Yeah, and first of all, anyone that knows us knows that we'll keep chatting, so I don't think we have any problem there. Um, but
absolutely.
frankly, I'd like to see them be a little more bipartisan. And without getting into the politics of it, for a long time, there has been a notion that the HSAs are for the rich because it is a tax-favored account.
Right.
Um, might be interested to know that the average HSA account holder has a lower annual income than the average American. The average HSA account holder lives in a household with a lower annual income than the average American household. These are not just accounts for the rich. And I think that that is a misunderstanding that maybe has benefited some people politically, but it really has not helped the American consumer. What we can say is, especially with these particular expansions, if you look at the ACA bronze thing, the ACA metal tier program and trying to control costs and create choice in that way is let's be honest, essentially a Democratic program. To see Republicans expand that program, we think is great news because we do think, as you said, it's been such a divisive issue. We do
Yeah.
think it's time to maybe put the swords down and pick up the pen and try to find a way to a better outcome. So for Democrats, that should be seeing HSAs as a tool for improving affordability and access, especially for underserved populations, right? Now, for Republicans, it's a little bit more of a straightforward, hey, these are a market-based solution. This encourages consumer engagement and reduces government involvement. There's no reason we cannot do both. And I cannot emphasize enough, specifically expanding the ACA, a government program, with the HSA, and we made this point actually when we had these conversations, is to say you actually have an opportunity here to unite two programs that one side or the other has, at times besmirched, and maybe turn the rhetoric down, turn the tone down on that. That shared ground is why we think we're going to continue to see more conversation about expanding the definition, and why we certainly hope that that is the case, regardless of what political affiliation you have.
Right. Oh, I agree 100% because regardless, it's about our health and the healthcare of this nation and where we're going. So I appreciate that, that perspective on that. I know we're running out on time, but we'll have a couple more things. So, okay, so let's talk about so for brokers and HR teams that are watching this, what's the first thing that they should be doing to prepare for these changes? Because I've had a couple of those questions. Like, I've gone out to see some of my broker partners and they're like, Heather, what does this mean? How is this going to affect me as the broker? And then how do I communicate this to my HR partners?
Yeah. So, I mean, as always, take a vigorous look, maybe a fresh look at your strategy, especially thinking about plan design. Are the things that you're offering the options that meet the current needs, but are also positioned to adapt as things change, right? There are other things in the bill, as we referenced. There was some noise about what's in the bill in terms of other things changing access to care, et cetera. So how are you communicating about these things to your employees? Are you educating them specifically on the value of the HSA? The HSA, which we, of course, understand the value of this product. Most people still don't realize that there are near-term and long-term benefits to the HSA. And we just, like I said, we just got 7 million more people eligible. So staying informed as the rules are evolving is really important, but more importantly, keeping an open dialogue because these are complicated issues. I've sat in a room with Heather where she has explained these things to other people, and though she does a great job, it's not something you can do in 10 seconds. It's something you have to have an ongoing dialogue, and it's very hard if it's not interactive. It's very hard if you can't stop and say questions on that. And so having that dialogue, staying informed and planning ahead now is the way that I think that you can not only respond to this, but be prepared for what's coming, whatever that may be.
Right. No, and that's amazing. And I got to be honest with you. So yesterday, like seeing these expansions and what's happening, I went to Sephora yesterday, which my daughter and I love to go to Sephora. And I'm like, okay, so with this expansion, there's different things that are eligible through the HSA. So there's all kinds of fun ways we can look at this bill and see how things are changing. If there's products with SPF or certain things that we can, our HSA can pay for. So, I mean, it's definitely, regardless of that, like I kind of make like light of that, but it's definitely, there's a lot of things that are opening up now because of this. And, just keeping that in mind. And I would say just, finally, Jordan, just one last question for you. So I know you've worked on HSA, the policy for years, because obviously that's the grounding, product that Lively was built on. And so how big of a moment, like my hair is kind of standing up right now. I got to be honest with you, like asking you this question, my hair is standing up because how big of a moment, is this bill in the history of HSA legislation? Because you've been doing it a little bit longer than me, but I just like literally my hair is standing up. It's like, what does this mean? Like, it's pretty amazing, I think.
No, and thanks for giving me the opportunity to say it.
Yeah.
It's a big moment. It is, and there's two reasons for that. One is because of what happened. This expansion is unprecedented. But the other is because of the conversation, because of what else was on the table. And there were some creative ideas, maybe ones that I wouldn't have thought of, that were out there and that we had a dialogue about. And for the first time in years, we have seriously redefined what you can do with an HSA. And I am optimistic that we are at a turning point. That where instead of being stuck in, oh yeah, that only works for you if you're over there in that very specific kind of plan, and that only works for you if you're rich, or that only work, these kind of tropes that arise. I'm optimistic that that account holders, consumers, and specifically policymakers are going to see a more broad application here. For me, the momentum continuing is the most important thing. And obviously, we hope that leads to a wider array of options and eligibility specifically for that HSA. But it's an important moment, maybe got overshadowed by other things that tend to dominate the news cycle. But this is worth paying attention to, and it's worth engaging with, and it is worth celebrating as well. So thanks for giving me the chance to do that with you today.
Oh, well, thank you, Jordan. Thank you so much. And I just want to say, okay, this is our first lively conversation. So I just want to say thank you, Jordan, for joining me today. And we're going to have some of our other RSCs jumping in on and do this moving forward. But I'm very thankful that we had the opportunity to talk about this and discuss this, as it is a big deal, like for the nation, for everyone involved. And Jordan, thank you for joining me today. I enjoyed our time together.
Thanks, Heather. Anytime.
Thank you.